Well, for parents-to-be, it's a terrifying diagnosis, news that their child will be born with a life-threatening genetic disorder.
But thanks to a team at a Bay Area hospital, there is amazing new hope. Juliette Goodrich has an exclusive look at saving baby Ryan.
Meet little Ryan. He's a one-year-old bundle of joy.
He likes to play around with me, likes to jump around with me a lot.
His parents, Maya Queen and Robert Bell, just adore him.
Ryan is a goofball, but he's also very calm. So you won't see him lash out. Like on the plane, he was well behaved the whole plane ride.
A plane ride that brought the family from Washington, D.C. to the San Francisco Bay Area. Their destination, UCSF Benioff Children's Hospital. Why here?
Well, Ryan has hunters, and we are a part of a clinical trial.
I hope that he can just be normal like any other child.
Before Ryan was born, a prenatal screening revealed he had a genetic disorder known as Hunter syndrome. Maya's little brother has it.
Hunter's runs in my family. My great-grandmother, she carried the gene as well, so 3 of my great-uncles had Hunters and sadly passed away from Hunters.
Hunter syndrome is one of several inherited conditions that fall under lysosomal storage diseases. With these diseases, the body can't make certain enzymes, and that causes toxic byproducts to build up.
And that over time causes organ damage, for example, in the liver, in the heart, in the brain, in the bones, kind of depending on which of the enzymes a patient is missing.
When the baby is born, the damage is already done. A treatment exists where after birth, patients are given the missing enzyme through an IV every few weeks for the rest of their lives. That got UCSF doctors thinking.
You know, if you have a disease and there's a medicine for it, you wouldn't ordinarily wait many months to take the medicine, you would take it right away. And so that's, you know, at a simplest level, that's what we're trying to do.
Dr. Tippy McKenzie is a pediatric surgeon at UCSF. She thought, why not give the enzyme treatment earlier, before birth, to the fetus? In lab mice, it worked.
For birth, what we found in our experiments was that the enzyme could actually get into the brain, into the cells that actually need to make the enzyme. And so we're hoping that that can improve outcomes.
UCSF then got permission to begin a clinical trial on pregnant women. Maya and Robert were the first to sign up. In 2022, they came to UCSF when Maya was pregnant with Ryan.
I was more worried and cautious because I've heard several things about different trials and what could happen, what couldn't happen, but it was something about this in particular trial that gave me hope.
This is amazing that we're really delivering the medication before birth.
Dr. Juan Gonzalez Velez is a maternal medicine specialist at UCSF. He delivered a series of enzyme treatments by inserting a very thin needle into a vein on the umbilical cord connected to Ryan.
So we do it in the operating room under sterile technique and under ultrasound guidance.
The couple then returned to the East Coast where Ryan was born. Now, for the very first time since birth, Ryan has returned to UCSF for a checkup. His first stop, UCSF Benioff Children's Hospital in Oakland. So far, so good.
Went very well. He's a really normal appearing 1-year-old.
Then a trip to UCSF in San Francisco, where the doctors examined Maya, but they were wowed by the little boy.
Oh, he's doing amazing. It seems to be meeting all milestones.
It was just so incredible to see Ryan, who, you know, we only knew from his fetal ultrasounds, to actually, you know, be this growing, thriving 1-year-old child.
While it's too soon to draw any long-term conclusions, Ryan's already a superstar.
We're just grateful that he just got a chance early on.
A chance to live a more normal
I
life.
would rather give him a fighting chance than to just sit back and watch things happen.
Oh, he's adorable.
Yes.
Well, not surprisingly, pregnant women from around the world have signed up for this trial.
Yeah, so much good work happening at UCSF.
No question.
All right. Well, for more information, you go to KPIX.com.